They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started. All right, welcome back, everyone, to another great episode of the Decoding Health podcast. In case this is your first time, I am your host, Dr. Urban A. Kiernan, just ready to go and share with you guys another nugget of information and wealth so that you can live the best life possible. I'm joined today with our new technician, Chase. He's going to be helping me out in terms of, running this particular episode, in which we have a returning guest, Dr. Thaddeus Connelly, the first Dr. Cubed that I've met in my life. In case you don't understand your powers, that means he has 3 doctorate degrees. We had him on before. Great episode in which we were talking about, he's an oral maxillofacial surgeon, dentist, and has a PhD in oral maxillofacial surgery. So previous episode, I highly recommend everybody check it out. We were talking about facial structures, how the skull is actually shrinking, leading into impaired glymphatic emptying, potentially making us more predisposed for the development of neurodegenerative disease and Alzheimer's. And then we started talking about the brain and mind and quantum chemistry, which, he's also the head author of the Quantum Distillery. So I highly recommend that everybody sign up for his newsletter. That is always a treat if you're into that type of nerdy stuff. And if you go and you look at Dr. Connie's little, bandana right there, because he is a surgeon. Obviously, he was in the OR, a little bit of Bart Simpson, makes him kind of a nerd himself. But nonetheless, we're all ready to go. Hey, Thad, welcome back on the show. Just for the sake of the audience, take a little bit to reintroduce yourself to them, and we'll get started on today's topic.
Yeah, sure. It's a pleasure to be on again. So I am an oral and maxillofacial surgeon, originally from northern New York, a place that's pretty cold right now. I'm currently in San Francisco, which is not so cold. I did my undergrad University of Miami, did some research in neurosciences after that in Maryland, looked around for some way to support myself, and so decided to go to dental school. And did that at Columbia. And during dental school, realized I wanted to be an oral surgeon, and applied to the residency out in San Francisco. And so now I completed the residency in San Francisco in 2007, and that included the MD degree. So that was my second doctoral degree. And then I'm a total glutton for punishment. I decided that I'd go and finish my PhD as well. So it took another 3 or 4 years after that to get my PhD. And so after that, you can't really go out into the real world. So I stayed in academia, more or less, and I am a professor at the University of California, San Francisco. My main gig is at the San Francisco VA Veterans Affairs Health System, and I do a mixture of clinical work. I do things in the OR, and I do research, all kinds of different topics that pique my interest, including jaw joint research. I do research on bone regeneration. I do research on the lymphatic system and the brain, and every time I turn around, there's something else that interests me, and I try to start a project, and so but it's all fun, and so I basically been doing research for 30 years. Started with neuroscience research, and I sort of, in many ways, have never left neuroscience. Which is why I'm still studying brain stuff today. And it's just nice to be in an environment where there are a lot of like-minded people. And UCSF, University of California, San Francisco, and it's always easy to find a collaborator. Although it's always easy to find a collaborator halfway around the world these days with Zoom and LinkedIn, and you can bump into anybody anytime. And that's been kind of the amazing thing, since COVID, really, and continues to be a journey.
And that level of technology and experience actually is how we're able to go and use Riverside here, where you're in San Francisco, I'm in the Phoenix area, and we're able to have a live conversation to be able to go and hopefully make everybody's life better out here. And so, again, a lot of talk of neuro, and again, last time I checked, the brain is very, very important. And unfortunately, we're all getting older, and that cognitive decline is a very, very real thing. And I do remember at one point in time, you told me that a lot of the surgeries that you perform are actually for sleep apnea, and
Correct.
How disturbed sleep actually impairs cognitive function, and it all comes back to the glymphatic system. And this isn't going to be the main topic for today, but since it is your one of your most common surgeries that you are doing, can you elaborate a little bit, why would sleep apnea go and impair brain function?
Right. So it's a really amazing story, actually. So the glymphatic system. Yeah, for the longest time, people didn't know how the brain got rid of its waste. They assumed that macrophages and other brain cells came in and ate up essentially the waste in the brain, and that's how the brain took care of its waste. And I guess about 12, 15 years ago now, they characterized a system in the brain that was designed to bring in fluid, fresh fluid, and take out the old fluid with all the metabolites from your brain cells. And your brain is the largest consumer of blood flow, and it takes up a lot of energy. And so there's a lot going on in your brain that needs to be cleared out. Metabolically speaking, and the way it's done is with the glymphatic system, and so there's some specific things about the glymphatic system. One of them being is that it's most functional at night in non-REM sleep, and so. If you think about it, it makes what the glymphatic system does. It basically turns on the faucet on one end, and opens the drain on the other. And so it basically pushes fluid through the brain parenchyma, the brain substance. And as it does that, all of the synapses that are used to firing and being very precise, they get flooded out. And so you can't get precise, accurate signaling within the synapses. And so because of that, you want to have an active glymphatic system when you don't need to think, when your brain is not doing thinking stuff. And that's in non-REM sleep. You're not dreaming. You're not consolidating memory. You're not up awake thinking, having to attend to the world. And that's the time your glymphatic system runs, is non-REM sleep. And so here's where sleep apnea comes in. Is sleep apnea is an obstructive sleep apnea. There's obstructive sleep apnea, and then there's central sleep apnea. Some people have a mixture, but obstructive sleep apnea is where the airway actually closes off during your sleep, and you get a desaturation. Your oxygen level in your body goes down because you're not breathing. It's like holding your breath for 40 seconds. And so what that does is obviously that does many negative things to your body on a systemic basis. But what it also does is it makes you wake up a little bit. And that little awakening breaks you out of that non-REM sleep and causes the glymphatic system to halt its functionings. And so you end up with a start-stop of the glymphatic system and not a full clean out of all the metabolites in the brain parenchyma, in the brain substance. And so over time, you build up these metabolites that in of themselves can make you groggy. You know, if you've ever woken up in the middle of the night all disoriented, it's because your brain sort of hasn't turned off the glymphatic system and cleared things up enough to let your synapses fire. And so over time, what that does is it sets up conditions for the neurodegenerative cascade, where you start to get protein clumping, and then that clumping then spreads to other places, kind of almost like a virus. And then from there you get tangles, and then there are other things that characterize neurodegeneration, depending on the type, like tau protein, things like that. And so that's the key is of why sleep hygiene is so important, is because you got to clean out your brain every night. And
Absolutely.
if you're not doing that, you're running into a problem.
And in case somebody didn't know this, if you don't sleep, you actually will die. That's because most people don't realize this is the level of metabolic function that your brain has. It's one of the highest in the body. And, I'll mention Joe Rogan on one of his podcasts. He was talking about chess players and how actually they were losing weight during matches, and it's because they were thinking so hard. They were literally burning 6,000 calories a day in these chess tournaments because of the level of thought capacity. And I used to kind of like think it was like just burning the midnight oil, like with when it's like grant writing season. Just simply because you're staying up long hours in terms of getting these NIH grant submissions into play. And then afterwards, all you want to do is sleep. And now after better understanding that, it's like, well, is it because you were burning the midnight oil, which, I do plenty of times, like especially like on weekends, getting caught up with other stuff? Or is it simply fact that you are so mentally engaged into something? And actually, this is a very common thing with, healthcare professionals, is they're so mentally engaged in problem solving during the course of their day. When they get home, all they want to do is veg and sleep. Like they don't want to think at all. And so, it's kind of interesting, like how these dynamics are of human behavior, but there's actually potentially strong physiological roots that are driving all of that. And again, from a brain function standpoint, everybody thinks about metabolism. They think about your muscles, and we talk about that a lot on this show, but you got to feed your brain. But at the same token, you got to get that crap out of there. So, I appreciate you, Thad, Dr. Connelly, to be like formal here, in terms of taking the time to go and explain all of that, because there are so many factors that go into brain function, and just like the whole glymphatic system, and that is with a G, just for the record, because people were criticizing this. If you're watching this on YouTube and you're having YouTube do the subtitles on it, it's going to say lymphatic system. The algorithms aren't smart enough to do glymphatic. That has nothing to do with us. So please don't come back and tell us and tell the producers that we're being disingenuous. That we have nothing to do with those subtitles, but it is glymphatic system. So, but there's so many factors that play into brain function, including the gut brain the gut biome brain connection. And Dr. Malutanzi, who was on the show, she actually went into in depth on this. And that flora, the microorganisms living in your gut, and how that level of inflammation that your gut has a huge influence in terms of controlling the permeability of the blood-brain barrier, and then ultimately what that composition is of that fluid, that environment, that ecosystem that the brain is trying to go in and do all of this metabolic function in. So, from some aspects, you are what you eat. And they're really starting to there's a lot of money being spent on research regarding the gut biome. And, everybody's heard of probiotics, and even prebiotics now, and how those are becoming really more, it's not like a fad. There's actual real hardcore science in the understanding of that. But your gut biome actually isn't just down here in your intestine. It actually begins in your mouth. And so this is where I wanted to kind of segue, as an oral maxillofacial surgeon and a DDS, kind of explain a little bit about your mouth flora and how this whole thing is a part of your gut.
Yeah, no, absolutely. So your mouth, the human mouth, is one of the most diverse ecosystems on the planet. So there are well over close to 800 to 1,000 different species of bacteria, viruses, fungi that can take up residence in your mouth. You hear the story that it's getting bit by a human is like 100 times better than getting bit by, or 100 times worse than getting bit by a dog, because the human has a diverse diet that leads to the creation of this diversity of microbiological organisms. And so we spend a lot of time as professional dentists and now as oral surgeons thinking about the different types of bacteria that are in the mouth, and thinking about for the most part what they do locally in the mouth. And there are always cycles where people understand that, okay, there are bacteria in your mouth, and then everybody discovers that, these bacteria have something to do with your systemic health. And then people forget about it for 5-10 years, and then, they rediscover it. And because this was systemic health in your oral microbiome was something when I was a dental student 20 years ago. It was like a big revelation then. And then just in the last couple of years, it's again a big revelation. And I sort of wonder in my mind, well, what happened? It's the same problem, but it's just maybe a new generation of people discovered it or something. But it kind of fascinates me that it's just people forget the mouth is connected to the body, and of course it absolutely is. And when you're considering the gut brain axis, you have to think about the mouth as a source for some of the bacteria that are in the gut. So again, going back, you have bacteria in your mouth all the time. You need bacteria in your mouth all the time, called commensal bacteria that are good for you to be there, and you're good for them to survive. And there's sort of a synergy. And so one of the things that has come up recently, in recent times, is that some of the bacteria in the mouth that are good for you actually make nitric oxide, which then turns into nitrates and nitrites, which serve as a source of nitric oxide close to places in your body that use it. See, the thing with nitric oxide is very short-lived. I mean, less than a second is produced, and it has to do something, or it turns into nitrate or nitrite. And actually, I'll take a small aside, is that I didn't realize it at the time, but that in 2004, I was studying oral cancer and studying oral cancer pain. And one of the first papers I ever did on studying oral cancer pain was to look at the influence of inducible nitric oxide synthase. And it turns out that there is a higher level of nitric oxide, nitrates and nitrites in cancer than in normal tissue. And I didn't realize that theme was going to carry through kind of my career up until now, because nitric oxide is a very central player in many things, particularly in your vascular system, in your heart, in your cardiovascular system. So those bacteria in your mouth that make nitric oxide support the health of the lining of your blood vessels. Very important. It supports the lining of your heart. And that all goes to what happens in your brain, how nitric oxide supports the blood flow in your brain. And again, it's not directly nitric oxide. It's nitric oxide that feeds into the well of nitrite and nitrates that then can be converted to nitric oxide on the other end. And so that's the that's just, there are other functions of the commensal or the good bacteria in your mouth. And so, people say that, mouthwash is killing you because you're killing the good bacteria. What are you doing? What are you doing? It's impossible to kill all the bacteria in your mouth. Absolutely. You could use lasers, napalm, anything.
Napalm.
Don't
think you lose all your teeth with napalm.
People try strange things, right? No, but my point is that there are too many places in your mouth for bacteria to hide for you to ever even make a dent in killing a whole population of bacteria. Specifically there, kind of getting into the weeds a little bit, but I think it's important. There is a the gum tissue, the outer layer of the gum tissue is designed in such a way that if you look at it under an electron microscope, it's like sandpaper. It's like wavy sandpaper. And so it's designed like that because it supports a layer of organic layer and then a liquid layer called the liquid oral pellicle. And so you need that in your mouth because when you chew like potato chips, it keeps you from tearing your mouth up because it's sort of a lubricant and a tough layer at the same time. Basically what happens is the oral pellicle is formed mainly from salivary proteins and mucins and things like that. And that forms that protective lining. But bacteria also anchor into that pellicle, and they anchor in such a way where they form little environments for themselves to protect themselves. And so that's all of your mouth, under your tongue, on top of your tongue, and your tonsils, your oropharynx. So there are all kinds of places for bacteria to hide. So the idea that you're going to use anything that kills a population of bacteria is I don't think is correct thinking. So having said that, there are lots of bad bacteria in your mouth. And I will say that the bacteria in your mouth, interestingly, can run in families of they can share the same bacteria in the same household, from whatever, drinking on the same cup or, kissing on the lips or whatever. And so the general driver of bad bacteria in the mouth, however, is the formation of biofilm, so otherwise known as plaque, right? And so if you allow plaque, and it doesn't have to be all over your mouth, maybe just your back teeth. If you allow plaque to maintain itself over time, what that plaque does is it gets populated with a first generation of bacteria. And so what that first generation of bacteria basically lays the framework. It builds the foundation of that plaque. And then what happens is over time that plaque matures. And then other bacteria come in and build themselves little colonies on top of that foundation. And as the plaque goes on and matures more and more, you have ultimately conditions for the worst of the pathogenic or bad bacteria to live. Like say, the anaerobic, the bacteria that can't survive in oxygen, but are some of the most inflammatory bacteria there are. And so that's the major driver is plaque. And so there are two forms of plaque. There's plaque above the gum line, stuff that's reasonably easy to take care of, and there's plaque below the gum line. So above the gum line is supragingival plaque, and below the gum line is subgingival plaque. So the supragingival plaque you can get reasonably easy with brushing your teeth. The subgingival plaque is much harder to get because you can't reach it with a toothbrush. Matter of fact, you need to go for reasonably painful interventions to your dental hygienist or your periodontist, the gum surgeon. And so what happens with the either supragingival or subgingival plaque is that they form environments that stimulate inflammation. At first, that inflammation is acute inflammation, just like any wound has a characteristic set of cells that come by and do the things they do to resolve the infection. But in this situation of gum disease, you've got a situation where you aren't going to your body can't make it acute because it can't get rid of the source. And if you can't get rid of the source, then that inflammation becomes chronic. Mm-hmm. And so what that does is the chronicity of that inflammation then sets up an environment where you are locally the tissues are responding, making inflammatory mediators. And because your body is working hard to wall this off, and these inflammatory mediators are destructive, tissue destructive. You lose bone around your teeth, your gums recede or puff up, and all those inflammatory mediators are going into your bloodstream. And so your body can be exposed to these high levels of chronic inflammatory mediators for months, if not years. And these are the situations that set up heart disease, plaque buildup in your arteries, mm-hmm. Diabetes, insulin resistance. So it's your body being consistently exposed to these chronic inflammatory mediators that set this up. So if you think about it, there's no other place in your body where you would accept a long-standing infection that goes unnoticed, undiagnosed, and untreated, other than the mouth. The gut, yeah, because you're supposed to be there too, but you think about where in the body chronic inflammation comes from, and the vast majority of the time it's the mouth. And so that's why oral hygiene is so important, because you don't want to, you want to take that out of the equation. You want to take that possibility of chronic inflammation out. And so the mouth is the beginning of the GI tract, right? And so gut health is super important. You think about your gut, right? So if you took your guts out and laid them all flat, that's the square footage of a tennis court, right? So if you've got something going on the level of the square footage of a tennis court, that's going to affect the rest of your body. Right. And so I think mainly because of our diet, our diet in the last 100 years, you can see our diet has gone up in sugar, down in fiber, and so the sugar is bad because it makes environments for bad bacteria in our mouth. The fiber is very important for your gut health, for keeping your gut healthy. And so, what happens is that you get a situation where the bacteria in your intestines that are used to certain conditions that are created by fiber, they're not there, and they start to not produce things like short chain fatty acids. And when your gut starts to get deficient in things like that, the lining of the gut starts to become leaky. And when your gut becomes leaky, then things like things that are inflammatory that are in your gut, that are perhaps some of the bacteria that are not supposed to be there, create chronic inflammation as well. And those chronic inflammatory mediators leak through the gut and make everything worse on top, just like I described for the mouth. And so the connection of the mouth microbiome and the gut microbiome is that if you even have a mild level of chronic inflammation in your mouth, say mild gum disease or mild gingivitis, 40% of the it varies, but a significant percentage of the gut microbiome will have originated from the mouth. If you have a healthy mouth, it contributes very little to the gut microbiome. But if your mouth has even a mild level of disease, a lot of those bacteria make it to the gut and do things that are not supposed to happen in the gut, like contribute to that leaky barriers, and so just another place for your body to get exposed to chronic inflammatory mediators, and that have real strong effects on cardiovascular disease, the blood vessels in your head, stroke. So two of the major killers of us Americans are heart disease and stroke, right? So, not necessarily all of it will be attributed to chronic inflammation. I would say the vast majority of it do, and so the short answer is your diet is killing you, but not maybe how you think just by gaining weight. It's by promoting these chronic inflammatory mediators that are kind of killing you from the inside. And you can't heal the gut without healing the mouth, because it's all together, it's all one unit. And so that's kind of, I don't know. Did I go on enough about that?
No. This is great, Thad, because this is something that, to be honest with you, the majority of people are quite ignorant on. And everybody talks about, oh, you need a pretty brush your teeth, you need a pretty smile, but it's actually life-threatening. And Chase, I need you to pull up an image here of an actor who's unfortunately deceased, by the name of Andy Hallett. He was on the Warner Brothers show Angel, which was a spinoff of Buffy the Vampire Slayer. A very talented actor. Unfortunately, he's no longer with us because he developed heart disease, which was fatal, and they attribute it to a bad tooth. And so this is one of those things where, okay, you've got the formation of these plaques, which also leads to tooth erosion, it's a different process.
Yeah.
But now you get these invading bacteria, and I'm using the word invading very literally, because when they don't belong there, they're making it down into your lower GI tract, and it's just like, wow, that's really messing up the recipe for biological success. But now you've got this issue in which the bacteria, so you've got this addition of pro-inflammation. Okay, and we're constantly being bombarded by stuff that's going to put us into an inflammatory state. And now you've got this additional issue within your oral cavity that can increase that oral state. And I agree with you, Thad, there is a huge amount of disease that is either pathologically initiated or further driven because of this pro-inflammation. And now you've got this issue with bacteria now have, because of a rotten tooth, actually making it into the bloodstream, and that's sepsis. And that I used to work in a hospital. I've seen that kill people. And in fact, I'm going to throw out a personal story here. In 2012, I had what's defined as a stroke, and I thank God I recovered fully from that. But after that event, I went to the dentist, and they were looking at my teeth, and they were like, did something, like, I didn't disclose that to them, and they were like, did something happen? I'm like, why? Because they're like, your gums are like so inflamed. So I had to get that moderately painful invasive teeth cleaning simply because of that pro-stress event changed everything inside my mouth. And so I've got a quick question for you. We've got these two different examples here. And actually, before I go into those two different examples, I've got a third example because it's very topical. Unfortunately, at Christmas time, some friends of our family, the husband, he went into multiple organ failure because he came down with a strep infection, but he had a bad tooth, and the strep went systemic, and kidney shut off, like horrible situation. So you've got these three different situations, and I'm going to lump, they're all unique in their own level of facets, in which you got a bad tooth leading to pro-inflammation, leading into heart failure, death of patient. Another situation in which you've got bad oral health, and then an invader in terms of strep getting into the circulatory system, attacking multiple organs, which is absolutely horrible. ICU, brink of death, thank God, recovering. And then you've got my situation. I'm not going to sit there and say my stroke was caused by bad oral hygiene, but you had this potential response to a huge pro-inflammatory event that the body had to overtake, had to experience and overcome. I got to throw this out here, this whole concept of chicken versus egg. I kind of gave you both things. Like, as somebody who's in the field, like what are you seeing in this from a chicken versus egg standpoint?
So those are the tooth with the cavity is that's the chicken and the egg, of course. So what I'm talking about is gum disease. So these are things that most of the time fly under the radar without you knowing about it, unless you go to the dentist.
Sure.
So is mild gum inflammation, mild to moderate to severe. But these are things that you sort of accept in your body over time, and if not attended to, will expose every organ in your body with that chronic inflammatory milieu, right? And so it's the insidious disease that I think is by far the largest killer. It's if you have a bad tooth and an abscess, absolutely, that can go and cause a vegetation on your heart valve and kill you. It can cause a vegetation on your heart valve to release and give you a stroke. So that's kind of an acute issues. What I'm worried about are the chronic issues of the gum disease that are insidious. They're not identified, and we allow them to be there. Now, I think the chicken to that egg is our diet. Really, is our diet. A high in sugar diet promotes these plaque in our mouth. Sticky sugars, sticky things in our diet make it harder for us to get rid of that biofilm, that plaque, and the high sugar content makes it more likely for bad actors, bad bacteria to populate that plaque. And so, like I said, it's when that plaque sets up underneath the gum, that's a chronic source of inflammation, whether or not it moves into your bloodstream. I think, we evolved to be exposed to bacteria all the time through eating. So, you brush your teeth and you measure, look at your blood, you're going to find bacteremia there. We have evolved to deal with that because simply by eating a high fiber diet, we're going to give ourselves bacteremias just by the fact that the bacteria is there, the gum tissue is highly vascular, and some of it's going to make it into our blood system. Our bodies can handle that, but what it can't handle is deposits or collections of mature biofilm that are constantly stimulating local chronic inflammatory mediators, which are then taken up by the bloodstream, and spread to the rest of our body. And the fact that we are exposed to that on day in, day out, with no indication that there's a problem, is part of the issue. Is the main driver of a lot of these chronic diseases. Again, there's no other place in the body where we would accept an outright infection of bacteria that go untreated or undiagnosed. You have that a brain abscess, a lung abscess. All those things you are attended to very quickly, or it'll kill you quicker. The things in our mouth is sort of the window to the environment, right? So it's a transition place. So there's a level of acceptance of our body of knowing there are going to be bacteria there. However, I think, again, I blame diet. Over time, our ability with high sugar content and low fiber, the situation sets itself up for plaque that's hard to clean, plaque that gets under the gum line and then proceeds from there. So I really, in the hospital, it's always, we get consulted on like heart valve patients that have a vegetation on their valve, and they're always blame the dentition, and most of the time they're probably right. There's a bad tooth and a bad this, that. And but those are the more, like I said, the more acute events. It's a long-term insidious presence of gum disease, which really is presence of in bacterial populations, which are a source of infection that stimulate your body to make chronic inflammatory mediators.
I'd like to take a moment to thank one of our sponsors, Foresight Chiropractic. Foresight Chiropractic is a wellness clinic providing specialized care to maximize your human performance. Their cutting-edge techniques are gentle, non-invasive, and customized to you. Dr. Lavender and his team are committed to giving you the care you need to help you heal faster, feel better, and perform better than ever before. Find them online at foresightchiropractic.com. and mention this podcast when you schedule to get a free consultation and discounted nervous system exam. Again, that's foresightchiropractic.com. And I really appreciate that clarification. It's just, I'm not a dentist, nor do I I didn't stay at a Holiday Inn last night, nor did I play one on TV. So, I'm just going off of as a consumer of, dental health, like the general information that is provided to me either by my dentist or my dental hygienist. And it's almost like they use gum disease. I'm familiar with that, but it's almost used synonymous with, the development of cavities, which will lead to that bad tooth. But you're actually laying this out as two very different, pathways. Maybe there is some level of crossover, but let's just go and keep all of this in check. Even if you don't have a bad tooth, you could be suffering from early stage gum disease, which might be more advanced than what your dentist is.
Yeah, it doesn't have to be all over your mouth. It could be like, say, if you have your third molar or even second molars, it could be plaque that you don't reach around your second molars, right? And so if you never really do a good job at that, that's an area of chronic inflammation, right? Don't know how much specifically one would need, but I would, if the tip of your finger is chronically inflamed for a long time, that's concerning, right? So if one little area in your mouth, kind of a tip of your finger, and you have the four fingers like that, then that's like looking at the tip of all your hand.
Yeah.
And so it's just kind of, you have to sort of like, the thing is, we can't see it. We don't see it and we don't appreciate it. But again, where is the area where you have source of chronic infection that goes not treated and causes chronic inflammation? It's your mouth.
And so we do, hopefully all of our audience members have access to at least home dental care, whether it being a manual toothbrush or some sort of electronic sonicare or water pick, whatever. It's my understanding, and correct me if I'm wrong, there are certain parts of the mouth that you need to pay more particular attention to. You already mentioned about the molars, but also on the back behind the incisors, the canines, in both the top and the bottom. Those are areas of chronic buildup. Is that correct, in which somebody at home is watching this, man, I need to do, a little bit more care? Those should be the areas that they kind of focus on?
Yeah, no, everybody's different. Everybody has slightly different salivary flow. Some people are more likely to mineralize their plaque or to make tartar. Some people never make tartar because they just don't mineralize their plaque. So everybody's a little different. But, generally speaking, the areas that are hard to clean or not hard for you to effectively clean anyway, those are the areas where, if I look into your mouth, if I'm going to look for an area for plaque, it's behind your molars is where I'm going to find it.
Gotcha.
And so that's, generally speaking, those are the areas, particularly with diet related problems. That's where the sticky plaque lives.
Gotcha.
And that's where those bad bacteria set up shop.
Gotcha. So like from an oral healthcare perspective, obviously we talked about brushing, but those are areas that are just notoriously hard. That's why you get your wisdom teeth pulled. That's one of the excuses, better oral hygiene.
And it's true. I mean, because for the longest time, just to talk about wisdom teeth, people would go from time to time, well, don't take out wisdom teeth that are not symptomatic. And the problem with that is it backfires because the country of England did that maybe like 15 years, 20 years ago. And what happened is that they would leave all these wisdom teeth, and then all of a sudden all these 35, 40-year-olds showed up needing wisdom teeth extractions that were symptomatic. And what happens, would you rather take your wisdom teeth out when you're 17 or 45? 17. Because when you're 45, your bone's harder. The chances you get a numb lip or chin skyrocket because everything's formed. The roots are very close to the nerve. And so, but a 17-year-old, the bone's softer, more forgiving. The teeth aren't even totally developed most of the time. And so that's why we know that over someone's lifetime, if you keep your third molars in, the chances of having an area of chronic infection are high, and chances of like even just getting a cavity in the tooth are high. And it's a risk versus benefits, and getting them out at 16, 17, that benefits people over their lifetime. And
Gotcha.
So we know that. Yeah.
No, that's interesting. I had 3 of my 4 pulled when I was younger, and then the 4th one, the insurance refused to cover it until it became problematic. And it's just, okay, that's the payer system. That's a different issue. But in terms of, taking care of this, so now to help remedy, the potential issue, are we now talking like mouthwash or something? Like go and use like Listerine and just swoosh for 2 minutes and then spit it out, and hopefully the inner layer of your mouth doesn't come off with it. Like, what can we as mere mortals do?
Napalm. I got it. Napalm in a bottle. There you go.
Napalm in a bottle. No. You as an expert, like what should we be looking at in terms
Right.
of dealing with this?
Right. So the mouthwashes are something that you use on a regular basis. Some people just in the morning, some people in the morning and night. And so it's going to be something that your oral tissues are exposed to a lot over time. And so the first thing you don't want to do, and I think people have gotten this message, is use an alcohol or a hydrogen peroxide base. And I know there are still some hydrogen peroxides out there. But the problem with that is that you're creating free radicals. And what a free radical is, it's a molecule that is looking for an electron to grab from somewhere. And when it does that, it tends to destroy tissue. And not only does it destroy bacteria in that process, but it starts to affect your own tissue in that process. And so you want to stay away from things that are likely to do that, like alcohol, hydrogen peroxide, and even some of the chlorinated compounds can act similarly. So really what you want to do is you want to find a mouthwash that, one, is powerful enough to do what you want it to do, control the plaque, which again, the plaque is where all of the bad bacteria are eventually derived from. And you want to be able to kill the bad bacteria, control the plaque, but yet you don't want to overdo it and totally decimate the good bacteria. And so we've developed, I helped develop a mouthwash called Gingivi that does just that. So this mouthwash, Gingivi, is very powerful. It's as powerful as the most powerful mouthwash we use. So if I do wisdom teeth on you, most of the time the surgeon is going to give you chlorhexidine. Yep. And so chlorhexidine you can only use for 2 weeks. Because one, it'll start affecting your other tissues, and it'll turn your teeth blue. So nobody wants blue teeth that I know about. And so actually, chlorhexidine was developed in the 1950s in London, England, as an anti-malarial drug, and it turned out to be a kind of a poor anti-malarial drug. But for some reason, somebody knocked the bottle of it in bacteria and found out, shortly thereafter, all the bacteria were dead. And they say, "Eureka! We have an antibacterial agent." And to this day, it's about it is the strongest and too strong antimicrobial agent. I mean, I go to the OR and I wash my hands with chlorhexidine, but yet they make a mouthwash with chlorhexidine. And so it's too strong. And if you use it too long, it will start to affect the levels of those commensal bacteria, those good bacteria. So you need something on a daily basis that can be just as powerful, just as pinpoint deadly to those bad bacteria, but to be able to gentle enough to use it every day. And that's what Gingivi is. And so Gingivi has the main ingredient, the star ingredient is hyaluronic acid. And, we have hyaluronic acid all over our body. Guess where the highest concentration of hyaluronic acid is?
I'm not going to even begin with that. just tell me.
Umbilical cord. So hyaluronic acid sucks up water molecules, which makes it very cushy, stretchy, and forgiving. And that's what you need in the umbilical cord to protect the vessels that go from the mom to the baby. And so the high concentration of hyaluronic acid does that. So hyaluronic acid, we put in high molecular weight hyaluronic acid and lower molecular weight hyaluronic acid. Again, you have hyaluronic acid all over your body. It starts out high molecular weight, but as things break down, say you damage your tissue, what happens is hyaluronic acid stimulates receptors that participate in the wound healing process. And so the high molecular weight is trapped on the surface to produce the hydration, but the low molecular weight goes to the areas of damage and starts to help the healing, actively starts to stimulate the receptors that participate in the wound healing practice, like I said. And so we specifically went and designed it like that, to have those two functions. The second ingredient we have there is a molecule called pullulan, and that was actually derived from fungus. And so fungus are living organisms, but they can't walk. So when they become under attack, they have to have a means of defense. And so they make a substance that's similar to pullulan that's sticky. And so if you're a bacteria and you want to attack a fungus, you end up getting stuck in the pullulan and not be able to attack the fungus. And so we use pullulan plus PVP as a way to make the mouthwash overall muco-adhesive. Otherwise, it's saying it sticks to your gum. And so you remember a while ago I was talking about the oral pellicle, this organic and liquid layer that floats on the top of all of your mouth surfaces. So what happens is the pullulan and PVP get in and intermix with the liquid layer of that oral pellicle, and it stays in your mouth much longer than regular mouthwashes. And that's where we derive the benefit of the hyaluronic acid, and the antimicrobial that we use is CPC. And so other mouthwashes use it. It's because it actually is a very powerful antimicrobial. It's a very powerful antibacterial, antiviral agent. And we have pictures that are published of CPC actually going in and destroying the COVID-19 virus. It's not something we did. It's published. But we did our own viral assays, and CPC gingiva in general very effectively kills viruses. And so during cold and flu season, if you are looking for a way to sort of protect yourself against viral things that are out in the environment, gingiva is a good idea. And then lastly, I want to say we put castor oil in the mouthwash. And castor oil is a very potent anti-inflammatory molecule. The rinoleic acid in castor oil is what makes it so effective. It penetrates deep into the gum tissue to decrease that inflammation. And so if you think about it, if your gums are inflamed and puffy like they were after your stressful event of the stroke, you're going to have a hard time cleaning underneath those puffy gums, right? Sure. But just because they're puffy, they're blocking it. So what the castor oil does is it shrinks down those gums so you can get at the tooth surface where that biofilm is built up. And so it's a very, very important component of the mouthwash. Plus, castor oil actually is a really decent anti-nociceptive. And so what that is it decreases pain levels, which are great for after surgery, after gum cleanings, or even people just with sensitive teeth. It's really good at decreasing that. So taken in whole, all of these ingredients form a physical barrier which hydrates, heals, is antimicrobial, and anti-inflammatory. So I don't know what else you want.
This is great. And, for anybody out there who's like into getting facials and everything, hyaluronic acid is very common. For the very same reasons why you're using it. It helps with the elasticity and the flexibility of the tissue. It's pro healing. And again, when we're talking about this pro-inflammatory state, you have to induce, healing. So I find it really fascinating that, again, from the biopharma space, a lot of things are based around formulation. And you've created this unique formula, and all of these components that you listed, I'm sure there's other stuff in there too, but all of these major components you put in there are, well, it's not in there just it's because we just kind of threw it out. No, you articulated there's a very specific reason why all of these pieces are in there. And they serve a particular purpose to work in unison, for the better mouth, for the better oral hygiene and, I'm going to say, gut biome standpoint, because
absolutely.
because I grew up with, Listerine and Scope, and the only reason why you would use Scope is because that yellow Listerine was like god awful. Then they came up with the green Listerine. Okay, 2 minutes, I can deal with this, but it's
It's like doing, those old time mouthwashes were like 20-30% alcohol. It was like doing a shot of Jägermeister, right?
I'd rather do the shot of Yag, but nonetheless, you mentioned the tooth sensitivity. That's a very real issue. And, if you can't, again, I'm not going to go in and take a dump on regular mouthwash, because, it is recommended by dentists. And if you're to do something versus nothing at all, then, maybe, just go in and do that. But if you cannot tolerate the treatment, then the treatment is worthless. And so, here you have this unique product that you offer. If one of our listeners is interested in this, because until I spoke to you about it, Gingivi, never heard about it before. Where can somebody, get their hands on this stuff?
So you can go to our website, we set up a Shopify site less than 6 months ago, and the address is www.gengyveusa.com.
Awesome.
And so that, just go there. We have some free deals where you get free samples. You can get a subscription where we send you a bottle a month. You can get a 2-for-1, or there's buy one, get one half off, the typical kind of stuff. But go there, and we put a ton of information on that site. So I like to write blogs, and I've written so many blogs, but they're not all there.
Yes, he does like to write his blogs, and then I subscribe to all of them. It's actually really, really good in informative stuff. And, one of the points that I want to go and drive with this is, because you put all this stuff on LinkedIn like all the time, and there is a ton of science that you're putting out there in terms of each of these unique claims, part of this formulation. It's just, you just didn't go and make this. It's not like grandma gave me this recipe. It's just like, no, there is actual real, science behind each of these pieces, which I personally love, because, show me the data, and the data's there. I can't argue with that.
Yeah, I mean, before 6-7 years ago, before we identified the formula, or came up with a formula, we looked out there, and most of the mouthwashes on the market, stuff there that's been but still the same thing for 40-50 years, not changed. They'll change a color, they'll change a flavor, the bottle might look different, but essentially it's the same thing. And so we told ourselves we got to do better than that. We have to do something scientifically driven based on the research, based on scientific principles. And that's where Gingivi came from.
No, that's awesome. I again love your ethos. I love your thesis behind all of this. Maybe thesos can become a new word after that misspeaker. With that. But again, we've got the link to the website below. Ladies and gentlemen watching this, we're not talking about fresher breath and a nice smile. There's actual medical, systemic, your whole body medical benefit for your longevity, wellness, prevention of disease. So this is something that we should all be taking very, very seriously.
This is a way to decrease that insidious chronic inflammation that you might be not aware of, or ignoring, or both. And this very well might be a major driver of a lot of the things that kill us. And so why not use something that can help you out with that?
Yeah, and again, I'm going to even take a firmer point on it, in that chronic inflammation is a significant driver. It might not be the thing that starts off that cascade, but it sure as hell doesn't make anything better.
No,
Yeah, I'm just going to
no.
go and throw that out there.
Yeah.
Like from type 2 insulin resistance to type 2 diabetes, cardiovascular, it does not make anything better. Why have something that is treatable and preventable, throw kerosene onto a fire? And so I'll just kind of leave it that with my point. Hey, Dr. Connelly, Thad, really love having you on this show. Looking forward to philosophizing with you more regarding thoughts and quantum quantum brain activity. You know,
We're going to solve quantum consciousness before the year's out. I'll guarantee.
I mean, let's push that off to 2027. You know, for a solution on that. That's a pretty big problem. But I'm absolutely, you know, I'm all in on that. So, you know, ladies and gentlemen, if you want more information, go and look this gentleman up. Wealth of knowledge. Again, subscribe to his blogs. I think we do have the link to the Quantum Distillery below. It's a great read, a lot of fun. But again, take your oral health seriously. Check out this product. And if you guys have any questions, leave it in the comments below. Please subscribe. It helps everything out. And again, oral health. We all, last time I checked, majority of us all have mouths. We all use them. And when I was an undergrad in microbiology, we had to do cultures. I swabbed my dog's mouth and I swabbed my mouth. And my dog's was infinitely cleaner from a culture standpoint than what mine generated. And that was like kind of like, that's really freaking gross.
Yeah, your dog's was like the desert and yours like the Amazon basin.
Yeah, absolutely. Absolutely. But hey, Thad, really appreciate it. Ladies and gentlemen, appreciate your time. We'll catch you guys again on the other side. So until then, peace.